Hello, and welcome to this informational parent opportunity to share information about COVID-19 and the status in Montgomery County. I want to begin by thanking our partners who have been working with us hand in hand over the last 8 months in Montgomery County on how to best keep our students and staff members, and actually all of our residents in Montgomery County, safe and well as we're navigating this unprecedented and uncharted experience. Joining us for this information session is Dr. David Rubin, who is the director of the Children's Hospital of Philadelphia Policy Lab, Ms. Michelle Masters, the division director for communicable diseases in Montgomery County, and Dr. Brad Landis, who is the assistant executive director for Montgomery County Intermediate Unit. I am Regina Speaker, the Executive Director of Montgomery County Intermediate Unit, and I am honored to facilitate this session. We also have joining us Dr. Susan Coffin, who is a professor of pediatrics and infectious diseases for Children's Hospital of Philadelphia. She will be working with us as well this evening. And Dr. Landis and I will be utilizing this opportunity to set the stage and get information as far as where we are in Chester County, as well as what we can do to promote best practices today and moving forward. So without further ado, if we could begin with, what is the current situation in Montgomery County as it refers to cases and trajectories and where we are as our baseline?
So Montgomery County is continually staying at a moderate transmission. We are doing okay, as Commissioner Kush likes to say, but we are seeing an increase of cases. So starting from the date or ending from the date 10/29, we know that our positivity rate is about 4.3%. Our incident rate is 81.8%, and those rates have increased over the last several weeks. So we do plan that we will see increased cases in the winter time, but we are taking it step by step, using the data to make decisions that are best for our community.
One of the biggest challenges that school districts face, from superintendents to school board members, is when to adjust the delivery model. All of our school districts have a virtual option. Some have a hybrid option. Some have chosen to bring some grade levels or all grade levels back face to face. But what are the indicators that would prompt the district to adjust, whether they move from face to face to fully virtual, or when is it safe to have hybrid, and how do they make those decisions?
So Montgomery County Office of Public Health, as well as Commissioner Kush, have been attending meetings with our superintendents for a long time to do collaborative decision-making and metrics and thresholds. We're still in the development of formal numbers, but things that we're looking at to move to a virtual environment is if a school has linked transmission in the school, so having that school environment be a possibility of transmission. We are looking at data specific for school district municipalities instead of countywide. We know in the county there's a variety of populations, from East Greenville to Abington, it's different. So we want to make decisions based on the school district and the municipalities in those school districts. So we would have school districts look at their incident rate, specifically an incident rate between 80 and 100 per 100,000. And possibly a positivity rate between 5 and 8% to start having a collaborative discussion with us as the Office of Public Health to decide what's best for the community, either moving to virtual or continuing that hybrid education. And this is data that we also use from contact tracing to help support. So what's happening in our community that may impact our schools.
As we're talking about transmission and as we're talking about contact tracing, Drs. Rubin and Coffin, would you explain how is this disease contracted? How is it spread? And then with the contact tracing moving in, how do we find out how it was contracted from individual to individual?
Oh, you're on mute.
I'll start commenting a bit on how the virus is spread. and what we know works in terms of blocking its spread. So this is a virus that we've learned a lot about over the past 8 months. We've learned that the overwhelming majority of times when this virus spreads from one person to another is through respiratory droplets, small particles that move from one person to another when they're relatively close together. And that's important because it gives rise to probably the two most important prevention practices that we really need people to do whenever they step outside of their home, whether it's to go to the grocery or to go to school to teach or to learn. And that is mask. And the mask will do two things. One, it will prevent respiratory droplets from leaving your mouth or nose as you talk. But it also will prevent somebody else's respiratory droplets from entering your nose or mouth, the sites where a virus can enter and actually set up shop and cause an infection. The second way that we use this principle of respiratory droplet transmission to inform prevention is to just make sure we're far apart. You've heard us talk about needing to be 6 feet apart. That's why, because a respiratory droplet can travel through air currents for about 6 feet until gravity does its work and pulls it to the ground. So distancing plus masking of both of two people really is an incredibly effective way to block transmission.
So, Regina, some of these methods that Dr. Coffin is talking about now, we're applying them in our schools, particularly the masking and the distancing and keeping sick kids out of the school. It's remarkable just how well these protocols are working. They're very similar to the ones that we're doing in healthcare, and we're trying to prevent what Michelle said was linked in school transmission. We know that there are kids who are going to be have COVID and show up each week with COVID, and there may be a staff member or two. What we don't want is there to be transmission during the school day, and so far we've seen really good evidence that our protocols are working, similar to how they're working in healthcare. Certainly each of these strategies may not be perfect. There may be the kid who occasionally pulls his mask down and has to be told, put your mask on. But you have to have a lot of if statements in order for transmission to start happening in the school. The child who was sick got through the surveillance screen in terms of whether they could come to school that day. They'd have to take their mask off. They'd have to be in a group for a period of time. And you start to think about that, and you realize there are just multiple layers here that are trying to assure that we don't have large outbreaks in our school. And it's going really well so far.
Great, thank you so much. And I want to correct my erroneous use of the term. I used disease rather than virus. So I just wanted to correct that. But as we talk about Montgomery County specifically, Michelle, are you able to share with us the process of contact tracing? So if I'm listening to this informational session and I receive a phone call or I have information because I've been impacted, what can I expect as far as contact tracing is concerned?
So our contact tracing program, how we set up now is that we contact individuals who test positive within 24 hours from when we receive that result. And then through that contact tracing or that interview, that can last anywhere from half an hour to 2 hours. We get a list of individuals that meet that close case definition of within 6 feet for 15 minutes or more. We get their contact information, and then we spend time calling those individuals, notifying them of quarantine, talking about what quarantine really means, because I feel like that term is being thrown around for a lot of different reasons. So we make sure that they know what the recommendations are for quarantine and isolation. In Montgomery County, our contact tracing program is with community-based providers who can link individuals to services, knowing that, quarantine could be 14 days or more. Are you able to get your medicine? Are you able to get food and transportation? So we work on those social services as well. Now, dealing with schools, we do this directly with school administration and nurses. So if there's a positive related to somebody being in school based on hybrid learning, we work directly with those individuals to identify who would be close contacts. We hope there's no close contacts because you're practicing social distancing and masking, but there are individuals that are identified in a school setting. That list comes to us from the school, and then it's assigned to our contact tracers to notify. Usually what will happen is the school will call you and let you know that your child or you should not be attending school the next day. if you are hybrid and in person. If you're virtual, you can continue education. And then you'll get a call from the health department doing that formal quarantine process.
So this next question can be for all three of you. Just how can we reinforce and what are the best practices to promote health and safety in the COVID-19 environment? And I would also, maybe Dr. Rubin, you could comment on what you're seeing as the situation with athletics in a school setting and athletics in a community travel setting, and why that might be, and what parents might be able to do to help rectify the differences. So open it up to anyone.
So,
If I could, I'm sorry, Dr. Rubin, I know Dr. Coffin has to exit for another commitment. Dr. Coffin, would you like to begin on safety, health and safety tips before we turn it over to Dr. Rubin?
Sure. The one thing that I would say is that we're poised to have our schools be the perfect partners to help teach children how to do this safely. It has become, and it needs to be even further embedded into our culture, that this is how we keep ourselves and each other safe. And partnering with the schools to teach distancing, masking, hand cleaning, staying out when you're not feeling well of activities, and keeping yourself and others safe. These are great lessons that our schools can begin to embed and help foster across the entire community. And so I really think that that's a key takeaway for me about how to move forward with kind of the prevention efforts.
Thank you so much. And I apologize, Dr. Rubin, for interrupting you. And thank you, Dr. Coffin, for your opportunity to
Thank
join
you for your
us.
understanding.
Thank you.
So I'll just add to Dr. Coffin's comments, and just want to recognize the amount of fatigue that we all have. We're exhausted, all of us. The amount of stress that we're all experiencing, our kids are experiencing, this feels endless. This will end. We will get over the top of this mountain. But in the interim, that fatigue is we are sort of looking at the spring when there's more reinforcements coming, more tests, potentially a vaccine, warmer weather, which is going to help us in the spring. And now is the time to really kind of focus on really simple recipes. Wearing that mask, distancing, particularly as we move to Thanksgiving, keeping our gatherings small. I think Thanksgiving, I think we have to be very careful across the community and how we treat Thanksgiving. I'm not saying not have Thanksgiving with family members. Most people, I think, will choose to do smaller gatherings and find ways to connect. But if you're with older folks at Thanksgiving, is to really be very, very careful. And if we kept our gatherings small, we're wearing our masks, we're distancing through the winter. If we all committed to that, staying home when we're sick, we'd get through this pretty well. The problem is we're having a lot of challenges now. And, and I do think we have the benefit through the contact tracing that Michelle described at the health department to really understand where we're having challenges, and it allows us to try to improve it. So, for example, we mentioned that we've done really well in school, but we are seeing transmission. And where are we seeing the transmission? We're seeing it in carpools, where people get a little bit too comfortable around their friends and they take their masks off. Teachers or staff having a coffee break. And pulling down that mask and not recognizing that there might be a transmission event that could occur. We're certainly seeing it around extracurricular activities. I think more in the context of travel sports than scholastic sports, because I think there's been this deep partnership with the superintendents throughout the region to build up the safety protocols in the schools and the concerns around travel leagues. There have been so many outbreaks now that are now threatening our school reopenings and the ability to continue the journey together, that we have to have a serious conversation about and I think for those of us who participate, I used to be a travel coach myself, that we have to have the same level of discipline. And why do I say that? Because we're moving into a time now that the elephant on the table is in wintertime. We're seeing increased ICU admissions. We're seeing the increased use of ventilators. We're going to see numbers that are going to shock us and be very sobering. But we're not defenseless here, and it's just harder in winter. In wintertime, people are coughing, they're spreading the virus more easily. The virus likes to hang in the air, and our gatherings in particular are, the virus will spread much more efficiently. And the degree to which we focus on those areas where we know transmission is coming from right now is going to be our way through. That is the way you defeat this virus. It's being very practical about the moments of transmission, and we know what they are. And if we do that, we're going to keep our kids in school.
I know both CHOP and Montgomery County Department of Health have resources on the web. Where could we direct parents to find those?
So we can start with Montgomery County. So Montgomery County, if you go onto our website, we have a school resource page and a school reopening page, which will give you all the outlines of our guidance, information about isolation and quarantine and contact tracing. We also have the Montgomery County COVID Hub, which will include data on incident and positivity. We've also included incident rates for municipalities, and that's also our link to our community-based testing sites.
And Dr. Rubin, where should parents or community members go to receive information from the Children's Hospital of Philadelphia Policy Lab?
Well, you can go to policylab.chop.edu. The links are there. You can actually see your own community's rates. You can't get down to municipality. Michelle and Dr. Akush got some secret data that they're able to share with you just on their website, right? Which is really important for our school districts because these decisions are going to be made very locally. But you can see your county rates. You can certainly see other counties in the region. And then you can see our full guidance, which has become enriched over time and honestly have been enriched by our work with the health departments and the superintendents throughout the area. And I think there are very practical strategies in there, but they really simplify down to those very basic things that we talked about at the beginning of the call.
Thank you all so much. Please know, for anyone who is watching this informational session, your building level and district level administrators are working hand in hand with both CHOP Policy Lab and the Department of Health in Montgomery County. If you have any additional questions, I'm sure they will be more than happy to either answer those questions or direct you to information sources to get you the answers you're looking for. Thank you so much for watching this informational session. And as more information becomes available, we will continue to update as possible. So again, thank you, Dr. Rubin. I want to thank Dr. Coffin, and thank you so much, Michelle Masters, for joining us this evening. And we look forward to having another informational session soon. Stay safe, everyone.